This is the miscellaneous training video for the 11.4.1 TouchWorks upgrade. In this video, I'll be addressing a few of the miscellaneous enhancements that come with this upgrade. The first enhancement is the ability for users to print or fax multiple documents at the same time. This can be done by selecting a document, holding the control button down while selecting the other documents you'd like to print or fax. Select Print, choose the Selected option. In this window, you will fill out the appropriate fields in yellow. Select your printer and click OK. This will print all documents that you have selected at one time. You can do the same function with faxing. If you select the documents that you would like, select the Fax tab, select Referring, and search our referring provider dictionary. It will pull in the doctor as well as the fax number, and you will have to enter in the requested date. If you click OK, it will fax to this number all of the documents that you have selected. I'm going to cancel out of here. The next enhancement is under the Problem tab. The problems will now be sorted by the My Priority, which allows users to organize the active problem list using the My Priority section. The next enhancement is Medications. Medications will now be sorted by ordering provider. It will list the providers in alphabetical order with the medications that they have prescribed underneath their name. The next enhancement is the Med Ed Flowsheet tab. This tab will display the medications in a flow sheet format, making it easier to view when the medication was last prescribed and the status of that medication. The last enhancement is the clinical summary. In this upgrade, the clinical summaries have changed dramatically. I'm going to print the patient's clinical summary by using the same function, the clinical summary icon, off the provider's schedule. I'm not going to print the summary, I'm going to preview it so you can see what the new clinical summary will look like by selecting this preview button here. This is the new clinical summary. I'm going to expand it for easier viewing. The first section is the patient's information. The second section is the chief complaint, which is pulled off of the patient's note for that visit. If the doctor has assessed any problems during that visit, any treatment plans that were documented, the patient's vital signs, a list of the patient's current medications, if any drugs were administered, a list of the patient's allergies. On the second page, it will list the remaining allergies. If any lab results were documented today, a list of procedures that were performed, if any immunizations were given, as well as a list of the healthcare providers for that patient, including their default pharmacy. The last section is the document detail, giving a description of where the document originated from. I'm going to cancel out of here. This concludes the miscellaneous training video. Thank you for your time.